Hi, all of you. My name is Dr. Elvis. I'm your new lecturer for health and social care. And today we're going to work on working with multidisciplinary teams in health and social care. My background has been in working in primary care research, specializing in HIV/AIDS epidemiology, cancer in primary care and palliative care, and arthritis of the hip and knees. But today I'm going to take you through how to work in multidisciplinary teams in health and social care setting. Right. Now, in order to provide holistic patient care and to achieve good patient outcomes, as well as maximizing clinical effectiveness and to encourage continuity of care, this concept of multidisciplinary approach in health and social care has become a key point in healthcare delivery. So the aim of this model is to help us understand and explore the concept of multidisciplinary work within the health and social care sector. We will also try to understand key professionals working in the health and social care sector and their respective and complementary roles. Besides that, we will try and identify relevant skills and possible barriers that multidisciplinary working may face and how to overcome it. We'll also try to analyze any practical communication issues that might be involved in working as a team. So these are our four main aims that we intend to achieve in this lecture. Right. We have also four main learning outcomes that we will try to cover within this module. The first learning outcome is to understand how to build and maintain working relationship with professionals from other disciplines. The second learning outcome will be to understand how to build and lead multidisciplinary teams in order to achieve integrated service delivery for all stakeholders. And then the next learning outcome will be to understand how to overcome barriers to multidisciplinary work. And lastly, to understand how to communicate with team members from other disciplines and with stakeholders. Now, let's first look at what the concept multidisciplinary team means. Now, when we say multidisciplinary approach, that involves drawing appropriately from multiple disciplines to explore problems outside of normal boundaries in order to reach solutions based on a new understanding of complex situations. For instance, if somebody has got lung cancer, for us to be able to provide holistic treatment, we need a team of experts to come together to be able to decide the right treatment and then to design appropriate care plan that will be useful for the patient. Again, multidisciplinary or multi-agency working involve appropriately utilizing knowledge and skills and best practices from multiple disciplines and across service provider boundaries. That could be from the health sector, from the social care sector, or even from voluntary and private sectors, all with the hope of trying to achieve best possible patient outcome. Now, in terms of multidisciplinary care, the patient is always at the center. Patient is at the center. So if you take a patient at the center, we can say that a social worker could be part of it, a psychologist, a respiratory nurse, occupational therapist, physiotherapist, a general practitioner, a pharmacist, a tuberculist, a dietitian, or pneumonologist can all work together in order to achieve a patient outcome. So the concept of multidisciplinary working, even though it's new, is a bit complex and involves a lot of professionals. And the aim of it is to provide the best possible outcome to patients and their carers. A multidisciplinary team, again, is a group of healthcare workers who are members of different disciplines. For instance, we will have a psychiatrist, social workers, and etc., each providing specific service to the patient. And the team members independently treat various issues the patient may have, focusing on issues which they specialize. For instance, with a lung cancer patient, the team might be from respiratory physicians. We could also have oncologists, and within the oncologist, we might have a medical oncologist. We have radiation oncologist, and then surgical oncologist. The medical oncologist must play a part in trying to look at how to deal with the disease condition based on chemotherapy. Whereas the radiation oncologist might bring in expertise from radiation that can be used to treat the patient. In the same way, the surgical oncologist will be able to deal with the issue from surgical perspective, probably after the medical oncologist has done the bit to shrink the tumor. The surgical oncologist may come in to surgically remove the shrinked tumor, and then the radiation oncologist will come in to try to use radiation to remove all the remnants of the tumor. So we could have oncologists, respiratory physicians, specialist cancer nurses, you might have Macmillan nurses, all coming together to plan, to assess the patient and to know the proper care plan that the patient requires. So multidisciplinary work is looking at the problem of a patient from different angles. Right. We'll try and look at how to build and maintain a working relationship with professionals from other disciplines. As I explained, bringing people from different angles to solve a problem involve skills of team building. And one of the underlying theoretical perspective is that of Tuckman's models of group development, which is quite a popular one, with the phrase of forming, storming, norming, performing, and adjourning. This means that in order to build a team of professionals from different disciplines, you need to get a team together and get them involved. Once bringing them together, they should be able to move on to the stage of storming, where they will voice out differences, different opinions coming from different angles for a common objective. So it will move from the storming to norming, where they begin to share common commitment of purpose. And then once that has been done, can also move on to performing, when the team will actually be doing its work. And then the last stage will be adjourning, when the group will disperse and then complete whatever task that is assigned to them. So the key points in the Tuckman's model are that we have team formation, usually following an easily recognizable stages known as forming, storming, norming, performing. And then we can use the Tuckman model to help our team reach the performing stage as quickly as possible by firstly identifying the stage of development that your team is. Then you use the plan that can move your team through to the next stage in the team formation process. And then we focus on hard work, we will quickly achieve or obtain a very high performing team. So when we use the case of the lung cancer patients, we will be able to follow the theory of Tuckman's model to bring the oncologists, respiratory physicians, the specialist cancer nurse, the Macmillan nurses together to build a team that will be able to address the problems that the patient is having. For an effective multidisciplinary team, in short MDT, they are actually formed with the motive of execution of tasks. And the purpose, the outcome, and the process of the team should be clear. All MDT structures and membership must be in place. There should also be meeting management. There should be assigned roles and functions for each member of the team. There should be integration of the care process, so that, for instance, a GP will not just release the patient to secondary care and then wash their hands off. There should be integrated care process, so that once the patient is referred from the GP to secondary care, they should be able to follow whatever happens to the patient. So there should be integrated care. Within the team, there should be debate and discussion. There should be an environment where people can be able to debate, bring their ideas, and discuss, all for the benefit of the patient. And there should be trust within the team. Now, if the team members, if the oncologist doesn't trust the respiratory physician, they can work together. So there should be trust within the team. And once that trust is built, what comes next is individual and collective agreement. Again, people must be accountable. So every single team member must accept accountability, all in order that they will be able to achieve result. So attention to result is also quite key. Let's look at roles and responsibilities of key professionals from other disciplines relevant to a specific job role. You might be working in the care home, you might be working in the GP surgery, you might be working in secondary care or in the hospital setting. Whatever job role that you are in, you will have a peculiar team that you can put together so as to meet patient care. So our example that we're going to follow here is urological cancer MDT service. Now, the MDT work together to plan and manage the care of patients diagnosed with cancer, as already explained. Now, if the patient has got, let's say, a bladder cancer, the cases will be discussed at the urology multidisciplinary team meetings, which usually work on a weekly basis. And then the plan is discussed with the patient and relatives afterwards. So the team will sit down, plan what needs to be done, and then after that, they will discuss it with the patient. Now, an MDT coordinator is appointed who will always coordinate the meetings. And the clinical nurse specialist is also a key worker who acts as a link between the MDT and the wider community teams like the GPs, social workers, and other voluntary organizations, including the Macmillan Cancer Support Services. So, moving on with the MDT composition for the urological cancer, we can have a core team of the MDT, who might comprise of the urology consultant, clinical oncologist, physiotherapist, radiographer, clinical nurse specialist, and then an MDT coordinator, as well as all junior members of the medical team. That is the core team. Then we might also have the wider team comprising of the GP, Macmillan Cancer Services, social services, and then the community nurses as required. Now let's look at outcome of MDT working. The MDT meetings are usually coordinated by the MDT coordinator for smooth running and coordination of information about the patient. And this coordinator will be a link between the core team and then the wider team. Now, the key worker functions as a link between the core MDT and the wider community team to ensure continuity of care. Now, continuity of care is quite important in working in the team. As I said earlier on, if a GP refers a patient to secondary care, now the consultants or the team in secondary care will form their own MDT working group. If it's a urological cancer or lung cancer, a team of maybe oncologists, respiratory physicians, specialist cancer nurses, and Macmillan nurses will form their own team and then decide and plan a line of action that will benefit or be suitable to the patient. What the key worker does is to link between the core MDT and the wider community team to ensure continuity of care. For instance, if the GP refers the patient to secondary care, after treatment, the patient needs to be referred back to primary care or back to the community. So the key worker will always act as a link between the core team and then the wider team. Having formed the team, that is not the end of it. The patient views and feedback about the care is also taken into consideration in agreeing their care plan, although patients might not be part of the MDT discussions. So we have the patient at one end and the MDT team, but whatever is agreed upon must be discussed and then have feedback from the patient so that when the two teams agree, then the care plan can be effectively implemented. So, in a nutshell, we need to be able to build a team for a holistic and effective patient outcome. Now, in order to build a team and maintain relationship, there are key skills that are needed. In order to build and maintain the team, I've already explained the theoretical perspective using the Tuckman's model. But then within the team, there should be an element of empathy with other team members. There should be skills for effective conflict management. There should be relationship building skills. There should also be effective communication skills, as well as careful information sharing. So when we take the first point, which is the empathy with team members, people have actually come from different professions with different skills. For instance, in the case of lung cancer patients, we have the medical oncologist, the radiation oncologist, the surgical oncologist, we have the respiratory physicians, specialist cancer nurses, and the Macmillan nurses, all teaming up together. They should have that scale of empathy with other team members so that they will be able to agree and understand each other to be able to work as a group in the interest of the patient. Besides that, they should be able to have effective conflict management skills. This means that the medical oncologist must see the patient's problem from a different perspective. In the same way, the radiation oncologist must also have a different perspective. Again, the surgical oncologist must also have a different perspective. This means that they have to be in agreement and work as a team to be able to succeed. Probably, the surgical oncologist might argue that the tumor size is too big. They need to shrink it to a level before it can be removed surgically. Then the medical oncologist must also bring in the idea that maybe they have to give 2 or 3 fractions of treatment in terms of chemotherapy in order to achieve the desired result. The radiation oncologist might not agree, but they need to discuss with each other so as to come into an agreement as to what is best for the patient. So the whole concept of multidisciplinary working is simply to be able to provide holistic patient care so as to achieve good patient outcome. It will also help to maximize clinical effectiveness. Each member of the group will be able to work effectively. And then the bonus is that people come in with different skills. So we have provision of range of skills that will come in to work together. And last, there will be continuity of care between primary care, secondary care in the community at large, so that patients will not be lost within the system. Because most often, at the absence of multidisciplinary team working, the GPs in the primary care will just refer the patient to secondary care, and the patient gets lost in the system. They will never come back to primary care. Meanwhile, GPs or primary care have more contact with patients than in secondary care. So if they are working as a team, then once the patient is referred from primary care to secondary care, they will take over, form the MDT team, decide the next line of action, design the care plan, and treat the patient. And then if the patient is discharged, primary care is notified so that other treatment will follow. If the patient is not going to be discharged, or if the care plan go the way of palliative or end-of-life care, then the Macmillan nurses, as well as the community nurses, will come in and then provide continuity of care. So the essence of multidisciplinary working is quite crucial. And I believe that at the end of this model, learners should be able to understand the concept of multidisciplinary working, how to apply it in your own work setting, and then how to work effectively as a result of these skills that you have achieved. Now, in order for you to achieve all the learning outcomes, we have designed 2 assignments. All the tasks are designed in a way that you can use your own working environment to look at what team that you can form. For instance, if you are working in the care home, then you can use the care home as an example to solve the 2 questions that has been set, which can be found on Moodle. If you are working in the GP surgery, then you can use the scenario that you are familiar with. Again, if you are working in secondary care, then you can use the scenario there to be able to give us practical analysis of how to be able to form a team within your working environment and how to be able to support patients and then design a proper care plan for them. The key references, we have the Tuckman's model that you can use. Again, if you look at the model, the key textbook that we are using is Multidisciplinary Team Working, from Theory to Practice. It's produced by Mental Health Commission, MHC 2006. Thank you so much for this introductory recording. Thank you very much. Bye.